Hello, and welcome to Seniors Count. I'm your host, Tula Mal. On our show, we believe that you are the foundation on which Boston was built. So our goal is to connect you to resources, benefits, and information to enhance your life. Thank you for joining us. Today, I want to welcome Carol Cannon. She's here with some information, health information on cancer prevention. Welcome, Carol.
Thank you, Tula. I'm excited to be here.
Great. So why don't you start by telling us why you would be someone good to talk to about cancer prevention? What's your expertise?
Sure. So I'm an oncology nurse. I've been an oncology nurse for about 8 years. And that means that I care for people who have cancer. My specialty is people who have leukemia and lymphomas. That's cancer of the blood and lymphatic system. What we call liquid cancers. A little bit different than things like breast and lung cancer, which is typically a solid tumor cancer. But currently, I am studying to get my master's to become a nurse practitioner with an oncology specialty.
Oh, very nice. How exciting for you.
Yes.
So why don't we start a little bit. Tell us, what are the leading causes of death among people 65 and older in the United States?
Sure. So the leading causes of death for people greater than 65 in the U.S., the big one is heart disease. And the second one is cancer. And then the third is cardiovascular disease. And then breaking that down to lifestyle changes that people can adapt that cause these things, there are three big things: tobacco use, physical inactivity, and a poor diet. And while heart disease and cancer and cardiovascular disease are all very different, they're also very interconnected because we can make a lot of lifestyle modifications to decrease one's risk for these things.
So are you saying that they're connected because of the reasons why people get the diseases? Is that
yes?
Okay.
Yes,
so that
exactly.
Being inactivity, you said
poor diet,
and
tobacco use.
Tobacco use. So
yes.
interesting. What are actual causes of death that people are able to modify?
So those are the three that I mentioned.
Okay.
So tobacco cessation is probably quitting tobacco is the most important thing someone can do to become healthier.
Even at a late stage, even at 75? Or?
Exactly.
Okay.
So research has shown that for people who are 65, quitting tobacco use can actually add on 1.5 to 2 years of life for men and 2.5 to 3.5 years for women.
Wow. So just that one thing,
exactly.
just removing that
exactly.
one piece. Wow.
On its own, I know. And they actually say that by quitting smoking, you're actually benefiting people who are exposed to the secondhand smoke, certainly, because those people receive up to 90% of the negative cardiovascular effects of smoking. So it's almost like they're smoking themselves.
Wow, that's really interesting. That could be a whole other show,
I know.
right?
Yes, exactly.
What are some of the most important things people do? So, I know we talked about, stopping smoking. Can you talk more specifically about changes in diet?
Sure.
And then maybe the levels of activity that people could do.
Absolutely. So adopting a healthier diet. A lot of the recommendations out there are for the Mediterranean diet, which is a mostly plant-based diet. So lots of fruits and vegetables, lean meats like chicken and fish, really limiting one's intake of red meats and fat. They say trans fatty acids can offer, by eliminating those, it can take away up to 20% of cardiovascular disease.
Can you talk a little bit, explain what that means?
Sure. So trans fatty acids are often, it's a substance found in a lot of processed foods.
Okay.
And if you look on nutrition labels, it's usually written as partially hydrogenated oils.
Okay.
And it's found in cookies and crackers, baked goods, a lot of fried foods. There's actually some states like California and New York that are limiting the restaurant use of trans fatty acids because of this reason.
Okay, very interesting. Now, so keep talking about so the impact these strategies have. So obviously, you quit smoking. You talked about how the impact of that. Changing your diet. Talk about how that impacts someone's changing in health.
Sure. So by impacting, so again, research shows that by adopting a diet plentiful in plant-based things, reduces all mortality rates. So that's like mortality, death caused by cancer and heart disease and cardiovascular disease.
Wow. So just removing some of those trans fatty acids, right, and then changing their diet to more lean meats and some more fruits and vegetables can change the course of people's lives.
Exactly,
right?
exactly. Another important piece of the nutrition is also limiting alcohol intake.
Okay.
And the recommendations are no more than a drink per day for women and more than 2 drinks per day for men.
Wow. So I think that's reasonable.
Yeah, 1 glass of wine. Right?
Yeah, 1 glass of wine with dinner. And then we talked about a third one. So there's a smoke cessation, the diet, and then exercise.
Yes.
So tell us a little bit about how much people would have to change their inactivity or their activity to kind of cause an effect, and then the impact of that, I guess, which is a similar question.
Yeah, sure. So the recommendations for physical activity are at least 30 minutes a day of moderate activity. So it's a little more than going for a walk, maybe a brisk walk.
So you want to get your heart pumping,
Exactly,
maybe
exactly.
some
Get your
sweat
heart
if
rate
you
up
sweat.
a little bit. Yes, sweating would probably be more strenuous, but moderate to strenuous activity is recommended, 30 minutes a day. And again, by increasing one's physical activity, you're decreasing your risk of mortality, and you're also preventing osteoporosis and obesity.
Wow. So for someone who maybe is completely inactive, right? Because obviously levels of moderation are different for everyone. So for someone who's completely inactive, they wake up from the bed, they sit on the couch, or they sit in an office all day, or whatever it is. Levels of moderate for them might be a brisk walk, right?
Right.
So
exactly.
30 minutes of just getting the heart pumping, getting a little perspiration going. Maybe for someone who is a little bit more active, maybe they do walk every day to the train or to the grocery store. So for them, it'd be a little bit more, right? So
Right.
I don't know, a jog or jumping jack, something to elevate them, right? So the
Right.
moderation is different for everyone.
Right.
It's not one thing for everyone.
Right, exactly.
Okay,
exactly.
very interesting. Let's talk a little bit about cancer screening test, right? Because that's your specialty.
Yes, yes.
Especially in tooth cancers. But so, what are important cancer screenings for older adults?
So cancer screening kind of follows one golden rule for older adults. So I think a lot of people say, at what point do we stop screening? At what point does the benefit, what point does the risk outweigh the benefit?
Yeah.
So kind of the guiding rule for cancer screening in people older than 65 is taking into account life expectancy and functional ability. So for people who have life expectancy less than 5 years and limited functionality, they actually screening is not recommended because there really is no benefit for those people.
So this is for someone who hasn't been tested at all, who may not have any diagnosis, but just if there is a sense that this person isn't going to have a life expectancy more than 5 years, then no need to do screening. Is that okay? Just to clarify.
A general rule. And of course, this is very individualized. Everyone's different. This is a discussion that one needs to have with their provider, or their physician. But that's kind of the general rule, and that kind of just starts the discussion. So there's kind of these categories of functionality, and the first one is called robust. So these people have a life expectancy longer than 5 years. They are functionally independent, and they pretty much follow the same recommendations as the general adult population. Okay. And then as people progress, into older age and end of life, the categories, there's less benefit for screening.
I could see that. And does it consider cognitive, maybe?
Yes, actually.
Okay.
So I'm glad you asked that. So actually, the third category is it's called moderate dementia, and dementia is kind of a general, vague term, but basically implies a decline in mental status. And so these people in this category, I think their life expectancy is usually between 2 and 10 years, which of course is a big
long range, yeah.
Exactly. But again, a conversation to have with your provider. And these people typically do not benefit from a lot of the screening tests.
I see that, yeah. Can you talk a little bit about the risks for, and obviously the range of older adults is pretty broad, but just in generally about the risks of cancer screening?
Sure. So I think, people think, oh, cancer, everything is good, all these screening tests are good, but every test comes with some risk. So I think probably the most obvious one is the colonoscopy for colorectal cancer screening. And the risks, although the risks are rare, there is a risk of bleeding, and that could escalate, into death, worst case scenario. And again, it is rare, but it can happen, and it has happened. So again, just weighing this again in a dialogue with your provider is important. I would say the colorectal cancer screening is probably one of the most recommended for adults greater than 65, and that includes the colonoscopy, usually every 5 to 10 years. That is covered by Medicare. Every 10 years for the average risk person, and then every 2 years if you are at high risk.
So is the colonoscopy one because it's invasive versus maybe a mammogram, which isn't invasive, or is that taken into consideration?
Yeah, certainly that does take into consideration. I think probably the colonoscopy is probably the most invasive screening test that is recommended for these for adults greater than 65. The mammography, I know that's kind of been a controversial issue recently. Yeah. The risks of radiation every year. I will say that mammography is still recommended every 1 to 2 years for people greater than 65. Again, I think the age goes up to 80. Okay. Again, those are for the people in that kind of robust category. And Medicare, again, does cover annual mammograms.
What are some other cancer prevention screenings? We talked about the colonoscopy, mammograms, but can you talk about other ones?
Sure. So I would say the other 2 big ones that are recommended are Pap smears for cervical cancer for women. Again, kind of another one that there's been a lot of changes recently. There's been changes in the recommendations for women of all ages. And actually, they don't really recommend Pap smears for people over 65. Their recommendation is if they have never received a mammogram ever, or a Pap smear, then they recommend doing up to 3 in this age group.
But so that actually happens. There are people who have never received one, and then
right. I know.
How did they manage that?
I know. It's amazing. I know, right? We get them every year. I know. It's amazing. Yeah. And then after that, then there really is no recommendation, and that is just for the robust category. So people who are a little more frail, have more illnesses, there is no recommendation for cervical cancer screening.
What about prostate cancer?
Yes, thank you.
For men.
Yes. So the 2 tests for that are the prostate-specific antigen, which is a blood test, just a blood draw. That recommendation is they do recommend. That's actually. The recommendation is to have a discussion on the pros and cons with your provider.
Yeah, because there's been controversy around that too. The research goes back and forth.
Exactly, it does. That and the digital rectal exam, which is an invasive exam. Those are actually recommended. Again, the PSA is recommended to have a conversation, and the rectal exam is recommended annually, and Medicare does cover both of those annually.
Let's talk a little bit about how that conversation, or how maybe you could recommend that conversation go with the doctor, because I think a lot of older adults are intimidated about having that conversation. They think of the doctor as the authority, but also, even I would say myself, like the doctor's always so rushed, and even if you come with your list, you feel guilty taking their time.
Right.
So help us think of questions that would benefit an older
You're
adult.
Absolutely right. Doctors are very limited on time. I think they have more to do and less time to do it. So I think the biggest piece of advice is to become prepared. And that includes having a list of concerns. I think one of the most important things, at the beginning of every office visit typically begins with, are there any changes in your health?
Yeah.
If things have changed since your last visit with the doctor or the provider, then, bring those up. If you noticed some of the warning signs for cancer, changes in bowel and bladder habits, or a lump that you might have found, weight loss or weight gain that's unexplained, things like that that are concerning you, very important to bring up. The second is to have a list of your medications. That's always something they want, and it's just nice to have that all in one place.
You can't remember all the time.
Exactly. And that includes things like over-the-counter medications and supplements and vitamins. And then finally, I would suggest bringing someone with you. It's just helpful to have another set of eyes and ears to absorb what the physician is saying. But then also, for them to share their concerns, because sometimes they have a different perspective of what's going on, with the patient. I think that can be helpful too.
It's funny, that question of, and have you seen any changes over the past years? Even when I go sometimes, I'm like taken aback. I'm like, it's nice, to think about those in advance is helpful, because when you're in the spot, it doesn't, the things that may have changed don't necessarily pop to your head, right? So weight gain or weight loss, someone may think, well, the holidays I put on a little weight and then I lost it. But you're thinking more when the items that you should bring up, and obviously correct me if I'm wrong, should be kind of bigger changes, right? So if it happened during the holidays, maybe not, or bring it up and see what happens.
Right.
But I think sometimes that question, people are like, what do you mean changes in my body,
Right, exactly. No, I felt the same when I was, coming up with this list and researching it a little bit. I felt the same thing. I feel like, your office visit is usually just kind of routine, and you're like trying to get in and out, and but it's important to have those things kind of on the tip of your tongue so you're ready.
Absolutely, yeah. And I put them on my iPhone, because that's something I have with me, but obviously first, and someone else, a little notepad, anything works, right? And then you have them in front of you. I felt, even when on my iPhone, I was like, okay, I have to go down the list. Right. You're kind of forced to. Maybe.
Exactly.
So I think that's helpful.
Absolutely. I can't tell you how many times I've heard physicians and other providers say, as soon as the office visit is over, I'm like 1 foot out the door, and the patient says, oh, wait, I have one more question. And that's typically the most important question of the entire visit. So it's just important to bring those up in the beginning.
Yeah. Can you tell us a little bit about just general maintenance screening recommendations that, may happen at your physical, but maybe that you could ask about, or at least maybe help have the doctor explain? Like for me, whenever they take my blood pressure, they're like, you're blah, 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 blah. And I'm like, I don't know what that means.
Right.
So maybe talk a little bit about general stuff.
Sure. Yes. So cancer screening is kind of one important big thing, but of just general health maintenance, some of the things that we do screen for are things like diabetes. And that's typically for people who already have high blood pressure. Again, high blood pressure screening is recommended for everyone, I believe, greater than 18. So, again, that's kind of universal. Let's see. Some of the other things are... some of the things, it's interesting because there are actually things that we do not screen for that are recommended against. And that includes things like anemia, and a good
So you mean that it's not recommended that someone screen for this?
Exactly.
Okay.
Exactly.
And why is that? Is this...
because the research has shown there is no benefit.
Oh, okay.
Yeah. Things like bladder cancer, lung cancer. I think those are the big cancers. Okay. And then kind of another just important piece to discuss is vaccines.
Okay, yeah.
So vaccinations for people greater than 65, they recommend the tetanus and diphtheria every 10 years for everyone. The flu vaccine, of course, annually for everyone. And then the pneumococcal vaccine for people greater than 65. Just a one-time thing. It's not every year. Okay. That's recommended for older adults.
So flu, obviously, we know because the flu changes every year, so it's good to be preventative about that. You mentioned... why the tetanus? So talk us to a little bit about that.
The tetanus and diphtheria, again, that's a kind of universal for everyone every 10 years.
Huh. I guess I'm probably missing that one.
I know. You kind of have have to go back and think about your own history.
And the pneumococcal, is that pneumonia? Is that to prevent pneumonia?
It is,
oh, okay.
yes. And that's
sure.
just because people greater than 65, we consider them, their immune system slightly compromised. They're at more risk.
They're more risk.
Exactly.
What about other things? So like you mentioned, when you come to your doctor's appointment to have a list of all your prescriptions, even over the supplements over the counter, are there any things that a person could ask, like maybe calcium pills or fish oil or something that maybe that people would have an interaction with their drugs? Yeah,
absolutely. So it's interesting because a lot of the supplements and vitamins, they are not regulated by the FDA. So it's hard for providers because we don't always know what the interactions are.
Yeah, okay.
So a lot of times I think we err on the side of being safer and recommend against, mixing those with other prescribed medications. One of the things that is in the literature a lot is the use of aspirin for preventing things like cardiovascular disease and even colorectal cancer. And the research really isn't definitive about the colon cancer. But there does show some benefit for cardiovascular disease risk reduction.
So that would be something someone could bring up and ask, like, should I be doing this after the age of 65 specifically?
Exactly.
Right? Well, if you can believe it, we're pretty much at the end of the show.
Wow.
I know, that went by fast. So I don't know if there's maybe a last thought you want to leave our audience with about, just thinking about their health and, as winter's coming, what should they be thinking about?
Sure. I think probably the most important thing in disease prevention is, you really know your body best, and you are kind of like the biggest defense mechanism against disease. So I would just say being in tune to your own body and noticing changes, kind of like the ones we talked about. And then just don't be afraid to ask. Don't be afraid to bring these up to your provider.
Great. Well, thank you so much for being a guest today and telling us about, how to think about cancer prevention and what people should be thinking about.
Thank you for having me.
You're welcome. Thank you for watching Seniors Count, brought to you by Mayor Martin J. Walsh and our Commissioner Emily Shea. To contact us, please call 617-635-4366, or you can reach us by the Mayor's 24-hour hotline at 311. You can also email us at elderly@boston.gov, and you can find us on Facebook. Take care and see you next time.
And I think to myself, what a wonderful world. Yes, I think to myself.